Welcome back to Cutting the Boards. In today's video, I'll discuss 10 rules every surgery intern must know. Whether you're about to start intern year, you're a fourth year medical student preparing for a sub-I, or you're already a surgery resident looking to improve, this video is for you. Looking back on my own residency, there are certain lessons I wish someone had sat me down and taught me before day one. None of these are about memorizing anatomy or knowing every answer. Rather, they're about becoming the type of intern that every senior trusts, that attendings enjoy working with, and patients benefit from. These are the 10 principles that I believe separate good interns from the outstanding ones. Let's get started. When I started intern year, I thought the best interns were the ones who knew the most medicine. I assumed that if I studied enough and always had the right answer, I'd naturally become a great resident. Looking back, that couldn't have been further from the truth. The best interns aren't the smartest, they're not the fastest, and they certainly don't know everything. The best interns are above all dependable. People can teach you medicine, they can teach you operative technique, they can teach you how to present patients more effectively, but what they can't teach is reliability and dependability, and that's what people remember. So what makes an outstanding surgery intern and also resident? In my experience, it's these qualities. They're dependable, they're prepared, they communicate well, they stay positive even when the day gets hard, they're teachable and willing to ask for help when they need it, and they're friendly. None of those have anything to do with test scores. They're the people everyone wants to work with and everyone wants on their team. One of the biggest lessons I learned is that growth doesn't start with intelligence. It starts with preparation. When you're prepared, people begin to trust you, and everything gets a little bit easier. Trust then leads to autonomy. Autonomy builds confidence. Confidence accelerates your growth. And before you know it, you've become the resident that people naturally can rely on. That entire process begins with showing up prepared every single day, showing up earlier than everybody else, and leaving at the end of the day only when the work is done. Rule number 1 is probably the most important rule in the entire presentation, and that is always be dependable. When someone gives you a task to complete, write it down, make sure you understand exactly what's being asked and ask for clarification if you need it. Complete the task, and then tell the person it's been done. One of the quickest ways to build trust in surgery is simply closing the communication loop. If you consistently do what you say you're going to do, your seniors will start trusting you with more responsibility, and this means more of an ability to learn within the operating room. Rule number 2 is something that you'll hear over and over again in surgery, and that is to always own your patients. Before rounds, you should know everything about them. Not just today's labs or vitals, but why they're in the hospital, what operation they had, what happened overnight, how their pain is controlled, what drains they're carrying, and where they're headed next. I always try to ask myself, if my attending asked me anything about this patient right now, would I be able to answer it? Because as the intern, your seniors should never know more about your patients than you do. Rule number 3 is to learn to anticipate. Great interns don't just react, they anticipate. Throughout the day, they constantly ask themselves, what is my senior going to ask me to do next? Before rounds, they review the new labs, look at the imaging themselves, they read consultant recommendations, and they don't just read them, they develop their own plans. Even if your plan isn't perfect, the habit of thinking ahead is what separates excellent interns from average ones. Whenever you're given a consult, see this consult as soon as you can, after reviewing them, and then develop your own plan and pitch your plan to your senior. And the key takeaway from this slide is that great interns solve problems before they're even asked. Rule number 4 is master communication. Communication, like surgery, is a clinical skill. Communicate early, communicate clearly, and communicate often. Update your senior as soon as something changes. Keep patients informed, keep nurses informed. Call consultants early rather than late. And one phrase I always remember was, bad news early is almost always better than bad news late. Rule number 5 is be the intern everyone wants in their service. This might sound simple, but it's incredibly important. Be easy to work with, show up early, stay until the work is done, be humble, help your co-interns, admit mistakes, stay positive, and at the end of the rotation, people won't remember every presentation you gave or every question you answered incorrectly. Rather, they'll remember what it felt like to work with you. Rule number 6 is learn with a purpose. Don't try to read an entire textbook. Read about today's patients, read about today's operations, read about today's complications. Learning sticks when it's connected to someone you've actually cared for. And if your attending mentions an important paper or landmark study, spend a few minutes reviewing it. Those small habits compound over time and will increase your ability to learn from every single patient that you encounter. Rule number 7 is mistakes are part of residency, but own them when they happen. You're going to make mistakes. Every intern does. You'll forget an order, you'll miss a lab, you'll give a presentation that doesn't go well. That's normal. What matters is what you do next. Own it immediately, learn from it, never lie, never try to hide it. Integrity is worth infinitely more than pretending to be perfect. Rule number 8 is preparation wins in the operating room. Every case starts before you scrub in. Know why the patient needs surgery, review the anatomy, understand the major operative steps, know the common complications, and before every operation, choose one thing you want to learn during the case. Over time, attendings notice who's prepared, and the more prepared you are, the more opportunities you'll earn in the operating room. The key takeaway is that 10 minutes of preparation can change the entire case. Rule number 9 is build relationships. Surgery is a team sport. Approach every consult as someone asking for your help, not as an interruption. Build good relationships with consultants, learn from nurses, treat everyone with respect. The people you work with today may be the same people you rely on for years. Reputation spreads quickly, and make sure yours is a good one. Rule number 10, your reputation is built daily. Your reputation isn't built in one heroic moment, it's built through hundreds of small interactions. Showing up on time, following through, staying calm, being honest, treating people well. In surgery, your reputation is one of your most valuable assets. Protect it every single day. If I could go back and give my intern self a few pieces of advice, this would be it. Reliability matters more than brilliance. Consistency beats intensity. Relationships matter. Preparation creates confidence. Every single day is an opportunity to improve. And finally, remember that surgical skill comes with time. Don't rush it. Be in the operating room as much as you can, but never neglect the patients on the floor. That's where you'll earn trust first. At the end of the day, your goal isn't to become the smartest intern. Your goal is to become the intern that everyone wants on their team. If you focus on these habits consistently, the knowledge, the confidence, and the technical skills will follow. Thank you so much for watching. If you found this video helpful, consider subscribing to my channel. I'll continue making content to help medical students and surgery residents become the best clinicians they can. As always, study smart, stay consistent, and your future patients will thank you for it. I'll see you in the next video.